Welcome back. Cancer screenings are not something any of us look forward to, but they are a part of life, especially as we grow older. Denver 7's LaSalle talked to a doctor to find out what screenings you need and which ones may soon get easier.
I'm pleased to be joined by Dr. Scott Joy, internal medicine physician at Swedish Medical Center and Chief Medical Officer from Health One Physician Services Group. Dr. Joy, thank you so much for taking time to talk with us today.
Yeah, good to be here, Katie.
So let's talk cancer screenings this month. We know that a lot of people kind of skipped that regular screening during the pandemic, but have things started to turn around since then?
Well, I think we're starting to see more patients come in for their preventative visits, their Medicare annual wellness visits. That provides us as primary care physicians an opportunity to talk about age-appropriate cancer screening. And some of the big ones we think about during a preventative visit: breast cancer, colon cancer, and lung cancer are ones that we're really focused on as we speak to our patients, particularly patients as they get 45 to 80 years of age is kind of a sweet spot to be talking to your physician about cancer screening.
And you just touched on some of the regular ones that people of a certain age should be getting. Are there other screenings we should be getting on a regular basis?
Yeah, I think for younger women, definitely cervical cancer screening is something that's very important. That really is important up to about age 65. I think it's very interesting, Katie, that in the next few years, actually even now, we have some studies underway that are looking at blood tests to look for certain proteins for early detection of up to 50 different types of cancers. And a lot of cancers that we don't have good screening tests for now, including pancreatic cancer, ovarian cancer, liver and gallbladder cancer. So I think a lot of our screening in the past has been done with imaging. A mammogram is an X-ray, colonoscopies are procedures, pap smears are procedures. Lung cancer screening is a low-dose CT scan, but the next generation of test is here, and it's really going to be a simple blood test done on a regular basis to look for abnormal proteins in an early stage.
And while we know every cancer is different, what can we do on a daily basis to kind of just lower our risks of developing cancer and staying healthy?
Great question. I think biggest thing people can do is, if you're a smoker, stop smoking. Smoking increases your risk not only of lung cancer, but also colon cancers, other internal organ cancers. So stopping smoking is a big opportunity. I think exercise regularly can help prevent and delay cancer development. Eating a healthy diet, high in fruits and vegetables, can be very helpful. And the other thing, Katie, that's emerging are we have vaccines to prevent cancers. We often think of vaccines as treating infectious disease. HPV vaccine, human papillomavirus vaccine, that often teenagers or young adults will get, that can be given up to age 45, and HPV vaccine can prevent head and neck cancers. The other vaccine that's available that can prevent liver cancer is being vaccinated against hepatitis B. So it's another opportunity during your wellness visit, talk about your risk factors for hepatitis B and see if you might be a candidate for a vaccine for cancer prevention.
Dr. Joy, thank you so much for your time and all of your expertise today.
Yeah, thank you, Katie.